How do antihypertensive medications manage blood pressure after stroke? When someone has a stroke, controlling blood pressure becomes a top priority to prevent another one from happening. Antihypertensive medications help by lowering high blood pressure levels, which reduces the strain on blood vessels and the brain. These medicines work through different mechanisms to keep blood flow steady and prevent further damage. For example, some drugs relax blood vessels, making it easier for blood to pass through without causing injury. Others decrease the workload on the heart, which helps keep blood pressure in a safe range. Managing blood pressure after a stroke is very important because high blood pressure is a major risk factor for both initial and recurrent strokes. Studies show that lowering blood pressure can cut the risk of having another stroke by about 27 to 41%. If a person has a history of high blood pressure before their stroke, starting antihypertensive treatment can reduce the chance of another stroke by more than half. Timing and target levels are key. Right after a stroke, especially if treatments like clot-busting drugs are used, blood pressure needs to be managed carefully. Too much lowering too quickly can reduce blood flow to the brain, which might cause more damage. Usually, doctors aim for a blood pressure around 130/80 millimeters of mercury for long-term control. But right after a stroke, the goals might be different depending on the type of stroke and the patient's condition. Different classes of medications are used to control blood pressure. Angiotensin-converting enzyme inhibitors and angiotensin receptor blockers block hormones that tighten blood vessels, leading to dilation and lower pressure. Calcium channel blockers prevent calcium from entering muscle cells in blood vessels, causing relaxation. Beta blockers slow the heart rate and decrease the force of heartbeats, which lowers blood pressure. Diuretics help the body get rid of excess water and salt, reducing blood volume. In emergency situations, drugs like labetalol, nicardipine, and nitroprusside are used because they work quickly and can be adjusted easily. Choosing the right medication depends on the individual's health. Factors like other illnesses, the type of stroke, and how soon the stroke happened influence the decision. The main goal is to lower blood pressure enough to protect the brain without causing too low blood pressure, which could reduce blood flow to the brain and worsen the situation. Overall, antihypertensive medications are vital tools in stroke recovery and prevention. They help by lowering high blood pressure through various mechanisms, reducing the chance of another stroke, and supporting overall vascular health. It's always important to work with healthcare professionals to find the best treatment plan tailored to each person's needs. Remember, managing blood pressure is a key part of stroke care, and proper medication use can make a big difference in recovery and future health.